Hi, this is Dr. Saila. Today I would like to talk about something that's very important in this season. As you can guess, it's common cold, which is a very common illness due to its recurring nature and the number of people it afflicts. Not that many people can afford to succumb to common cold and rest in bed for a week in this busy life. Today I'm going to talk about how to prevent the common cold once you know you're exposed to it. We are all exposed to cold virus. Doesn't matter how many precautions we take. It could be from a family member, it could be from your colleague, or it could be a co-traveler. You can never build a resistance to all the viruses that can cause common cold, because there are so many viruses out there and they even mutate, so it's difficult to get resistance. You can only take precautions from getting it once you know you're exposed. First of all precautions is to avoid close contact with people who have colds. I know it's not easy, so I'm coming to the next one. You need to know how the cold virus spreads. Cold virus is attached to the lining of your nose and throat. Once attached, it starts replicating. Can you do anything to prevent when a close family member has cold? Yes, you can. Most important of all is hand hygiene. To reduce spread of the cold virus, wash your hands often, thoroughly, and avoid touching your nose, eyes, and mouth with your hands frequently. Since most viruses are spread through direct contact, rinse your throat and irrigate your nose with normal saline. If you don't have immediate access to saline, at least rinse with any clean water available. Remember, if you delay, the virus makes its home in your nasal lining. That means it's going to start replicating. So you should do it immediately once you know you're exposed. Second precaution, start taking vitamin C tablet, 500 milligrams of tablet every day. Generously consume food rich in vitamin C, such as citrus fruits, guava, broccoli, kale, and some peppers. Given the consistent effect of vitamin C on duration and severity of the colds, I would recommend taking it when you're exposed to cold and when you have cold symptoms. Many of my patients ask me whether they can take vitamin C supplements all through the cold season. I would discourage taking it every day during the cold season because there are some disadvantages of taking too much vitamin C on a regular basis. Especially mega doses of vitamin C can make you at a high risk of getting kidney stones, and it can give stomach upset, and it can make you more prone for internal bleeding also. So just take it only when you have cold or when you're exposed to cold. Further studies are needed on daily recommendations of vitamin C supplements. Next precaution is salt gargling. Add 1/4 teaspoon of sea salt to half cup of water and gargle with a mouthful of salt water every 4 hours. And do it more often if you have cold symptoms. There are no studies done on salt gargling, but it is safest and effective preventive measure. And don't swallow the salt water, just spit it out after you gargle. The next precaution is Echinacea Purpurea. This is a supplement that you can use only for a short period of time, just like vitamin C. You can use it only for 2 to 3 weeks when you think you're exposed to cold, or when you think you'll be traveling and you will be exposed to cold. It will strengthen your immune system when you use it for short periods, and the disadvantage is if you use it for a long periods, it can even weaken the immune system. And last but not least, don't forget to drink 8 glasses of filtered water every day. And most important, keep your immune system strong by eating healthy diet, good night's sleep, and positive attitude. In my next podcast, I'll be talking about how to reduce the severity and the duration of cold once you have cold symptoms. Please check my website, drsaila.com, drsaila.com, for more details on this topic and for the references. This information is based on my opinion. This is intended as sharing of knowledge and is not intended as medical advice or a substitute for your doctor's visit. If you need medical advice, always contact your own professional healthcare provider and do your own research. Thank you. That's it for today. Thank you for listening. And remember, as always, your health is in your hands. Thank you.